For millions of people with sleep apnea, treatment has always meant pretty much the same thing: a mask, a hose, a machine by the bed. But what if the best solution wasn't a machine at all? Today, we're going to dive into a totally different way of thinking about sleep apnea, one that actually works with your body from the inside out.
And that's really the big question, isn't it? Instead of just forcing air down your throat to treat the symptom, which is the collapsing airway, what if you could actually get to the root cause of the problem? That one powerful question is what led to the therapy we're going to break down today. So, to really get this new solution, we've got to start with the problem it's trying to fix. And that means taking a hard look at the limitations of the current gold standard, CPAP therapy. Okay, so just a quick refresher on what obstructive sleep apnea, or OSA, actually is. It's a mechanical problem, plain and simple. When you're asleep, the muscles and tissues in the back of your throat relax, and for some people, they collapse, completely blocking off air. Now imagine that happening dozens, maybe even hundreds of times every single night. It starves your body of oxygen and just completely wrecks your sleep. This slide lays out the two different philosophies for fixing that collapse. On the left, you've got the standard approach, CPAP. It uses forced air to create what's basically a pneumatic splint. It physically props your airway open. But look at the right. That's a whole new way of thinking. Neurostimulation. Instead of using an outside force, this approach gets your body's own muscles to do the job. And that brings us to the big paradox of CPAP. The thing is, it's incredibly effective, but only if you actually use it. And the data shows that a huge percentage of patients just can't deal with it long term. They can't tolerate the mask, the hose, or that feeling of pressurized air. So you have this massive problem where millions of people are left basically untreated. This is exactly where this new technology comes into the picture. And honestly, the best way to think about it is right here. It's like a pacemaker, but for your tongue. So what is Inspire therapy exactly? Well, it's an implantable system, and it's designed for a pretty specific group: folks with moderate to severe sleep apnea who have already tried CPAP and just couldn't make it work. It uses something called hypoglossal nerve stimulation, which is really just a fancy way of saying it sends a little signal to the nerve that controls your tongue. And by doing that, it keeps the tongue from falling back and blocking your airway. This is the absolute key to understanding the whole thing. We all kind of get how a pacemaker sends a tiny, timed electrical pulse to keep the heart beating just right. Well, Inspire works on the exact same principle. It delivers this gentle, timed pulse to that tongue nerve, which causes the tongue to move forward just a little bit, just enough to keep that airway clear so you can breathe. No forced air, just your own body doing the work. So that's the big picture idea. But how does this thing actually work? Moment by moment while you're fast asleep. It's this really elegant three-step dance that happens in perfect sync with your own body. First, there's a tiny sensor that gets placed between your ribs, and its only job is to detect your natural breathing rhythm, so it knows the exact moment you're about to breathe in. Second, right as you start to inhale, the system sends a very gentle pulse to that hypoglossal nerve under your chin. And third, that little pulse causes the tongue to move forward, opening the airway precisely when you need it open to take a breath. It's pretty amazing. And what's so great is that you, the patient, are in complete control. You've got this small little remote, you turn the therapy on when you go to bed, and you turn it off when you wake up in the morning. That's it. No masks to clean, no hoses to get tangled in, nothing. Okay, so this all sounds pretty incredible, right? But, and this is a big but, it is not a solution for everyone with sleep apnea. The success of Inspire really comes down to finding the perfect candidate. Yeah, they're looking for a really specific type of patient. First, you have to have moderate to severe sleep apnea, and you have to have proof that you tried CPAP and it just didn't work for you. There are also pretty strict rules about your body mass index and your AHI. That's the number of times you stop breathing per hour. But maybe the most interesting requirement is that last one. Your airway has to collapse in a particular way for this therapy to be effective. So how in the world did doctors figure that out? They use this cool procedure called a drug-induced sleep endoscopy, or DSIE. Basically, while you're sedated, a doctor uses a tiny little camera to go down and literally watch how your airway collapses as you sleep. What they're looking for is a pattern called complete concentric collapse. Think of it like a camera shutter closing in from all sides at once. If your airway does that, Inspire just won't work. So this exam is a super important step. So once the system is implanted, the work isn't over. Getting the implant is just step one. The real magic happens in the sleep lab, where the therapy is fine-tuned for each person. And this is where you see a really fundamental shift in the sleep lab. With a normal CPAP study, the sleep tech is busy all night, actively turning dials and adjusting the air pressure up and down to find the right setting. But with an Inspire study, the tech's job is totally different. They basically just observe and document how your body is naturally responding to the stimulation. They're not chasing a pressure number, they're watching a biological response.
At the end of the day, the goal of that sleep study is super simple. Find the sweet spot. What's the lowest possible stimulation level that can keep the airway open effectively, but also feel totally comfortable for the patient? Nailing that perfect balance is the key to making this work for the long haul. Okay, the process is fascinating, the mechanism is brilliant. I get it, but let's get to the bottom line here. Does it actually work? Let's dig into the clinical results and the real-world outcomes. Great, check this out. This is data from the huge STAR trial, the one that got Inspire FDA approved. These bars show the AHI. Again, that's how many times a person stops breathing per hour. You can see the average patient started at almost 30 events an hour, which is well into the severe range. But after a year with Inspire, that number plummeted all the way down to 9. That is a massive, life-changing improvement. And it's not just in the controlled environment of a clinical trial either. This quote sums it up perfectly. Out in the real world, patients are seeing the same thing. Their breathing events go way down. And just as important, they actually feel less tired during the day. This table really drives that point home. It shows what a typical outcome looks like. Patients go from having over 20 breathing events an hour down to less than 10. And at the same time, their sleepiness score, which is a standard questionnaire, drops from the sleepy range down to the normal range. I mean, that's the whole point, right? To breathe better at night so you can live better during the day. But we've also got to be realistic. As amazing as this is, it's not a magic cure. Inspire doesn't get rid of every single breathing event, and for sure, some people are only partial responders. It's also really important to know this isn't a one-and-done surgery. It's a long-term therapy that's going to need follow-up appointments and fine-tuning over time. So when you step back and look at the whole picture, what we're really seeing is a major shift in thinking. For decades, the only answer we had for a physical airway collapse was a physical blast of air. Inspire is a move toward a more physiologic solution, using the body's own wiring to solve the problem. And that leaves us with one big final question to think about. Could neurostimulation become a true second pillar of sleep medicine, finally giving patients a real, effective alternative to the mask and hose?